Hey, folks, welcome back to the show. This is your host, Ryan Kennedy, and I have a great interview in store for you today. As many of you know, I lost my mom to cancer in 2010, which was one of the driving factors of my life's mission and purpose of helping others get well and helping people optimize their health. And one of the many challenges of suffering from a chronic illness or health condition is this feeling of isolation. When you're the only person in your friends or family who's going through it, and also not being aware of other treatment modalities that may not have been presented to you by your doctor. Well, my guest on today's show, Dr. Varda Shalev, is one of the co-founders of a company called Alike.Health, which helps to solve these exact challenges facing so many patients in our world. Dr. Varda is a primary care physician, a professor at the Tel Aviv University of Public Health, and has co-authored over 250 publications in peer-reviewed journals. After medical school, she did her postdoc in medical informatics, and she's the one responsible for bringing this to Israel. So Dr. Varda, I'm grateful to have you here. Welcome to the show.
Great to be here this evening.
What I really want to discuss with you today, Dr. Varda, is your company, Alike.Health. You've clearly had a very accomplished career in the medical field. And while most people in your position would probably be considering retirement, you decided to found a startup. So what inspired you to start Alike.Health?
So actually, I'm a physician for many years. I have a partner, I have a clinic, and actually I grow up with my patients because I'm there more than 25 years together with them. And I see that we can't provide everything that we want to our patients because we don't know all the answers to all the patients. We don't have all the time with the patients. And I see that patients actually can contribute to each other, sometimes a lot more than I can contribute to them. And that's why I felt that we have to go back to the patients and empower them, because with the years I see that my main partner is not my partner physician in the clinic. It's not my secretary or nurse, it's the patient. And if he knows more, and if he feels more comfortable, we can achieve together a lot more. And that's why I co-founded Alike with Amnon and Ohad to accomplish these goals.
Yeah, and the two individuals you referenced were your co-founders. From my understanding, one is a cybersecurity pioneer, and the other is a data scientist. And then with yourself, a medical physician, you kind of make the dream team, to bring this concept to life, because obviously...
that's what we feel.
Yeah,
that we are a dream team and we can do it together. And all of us feel that we want to work with patients and to give them added value and help them to manage the health a lot better. It's very difficult to manage your health these days.
It is. And like you said, other patients going through a similar journey as you, whether they have the same illness, the same condition, the same challenges, they have other insights that they may have gained through their own research, through seeing other practitioners, through seeing people in alternative fields of medicine that they could bring to the table and share with other people going through a similar route. Like, hey, here's what worked for me. I changed this or this about my diet, my lifestyle. I started taking this type of vitamin supplement. I started seeing, maybe an acupuncturist or a chiropractor, whatever it is, and they could share that feedback and get amazing, collaboration going. So that's what I love so much about your company. And what have you seen as a physician of, what type of outcomes patients get when they interact with people who are just like them?
Yes, so actually, sometimes I do it in my clinic without technology. So I see a patient that I want him to get on with a new drug, for example, a new medicine or a new procedure, and he's very afraid and he doesn't know the consequences. So I have some patients that told me, if you have a problem doing that, refer them to me. So I do it from time to time, but it's very difficult to find the right patient because not every time you have the right patient in the same age with the same comorbidities, because we are not alike, everybody. And we see, now with the COVID, it's very easy to explain, actually. If you have COVID and you are 20 without any comorbidities, or if you are a female and you are 80 and you have asthma and COPD and most and some other comorbidities, the outcome is different. The journey that you're going through is different. So it's very difficult to do it in the clinic. So sometimes I do it, but it's not perfect. It's far from being perfect. And another issue is the privacy, because you have to refer a patient to a patient, and sometimes people don't feel comfortable to talk about themselves with others. So in Alike, what we did actually, we take your data and we totally anonymize it. And then we connect you to people like you with the same dimension of comorbidities, but not only comorbidities. It can be social determinants, it can be age and gender and preferences and other things. And then you can really feel that you talk to somebody like you. And if he is ahead of you in the journey, you can really get a lot out of it. About a new think about you're going to undergo a new procedure, a total hip replacement, okay? But you're afraid because you have diabetes, and your last time that you went under operation, it wasn't perfect, and you want to talk to somebody who did it half a year ago and went through this journey and has diabetes as well, and maybe has the same medicine that you take. So it's so much easier to talk to him. And by the way, he will give you a lot of tips that I, as a physician, won't be able to give it to you because I didn't go through it, you know.
I love that. Makes total sense. And it really is, as much as it can shed light on the physical aspects to the healing journey, I think it's the mental aspect of not feeling alone, having this connection with someone who's kind of in your similar position or was in your similar position. And that gives patients such a better frame of mind. And as I'm sure you're aware, the psychology of the process is just as important in terms of how you're managing your mental and emotional well-being. So I love that you shared that.
I agree. And, you know, we asked in one of the posts in Alike, we asked the patient, do you feel that your family members understand you? And most of them said no, because they didn't go through the same journey that I did. So even your family members, you feel strange with them. You don't feel that they understand you, and as you said, holistically, with your mental issues as well as your physical issues and your emotions and everything that goes with that. So your physician, he knows how to treat it, but sometimes you feel that he doesn't understand you.
Yeah.
That's why a person like you is somebody that you can really talk to him frankly about everything.
I love that. So one question that came to mind for me is there's a lot of health management apps out these days with the technology at people's fingertips. A lot of people are aware of other apps they're using to manage their healthcare. What really sets apart Alike.Health from some of these other applications people are using?
Yeah. So actually, first you can connect your EHR to the app. So we have access to providers' data. And by one click, you can upload all your data, all your comorbidities, lab tests, procedures. Many times you don't know how to pronounce it and what you have and you don't have. So one thing is the connection to the EHR. If you don't have EHR, then you can edit manually, but it's a possibility. And then you have explanations on each and every data item within the application, which is also something that is very difficult to look in the net because you don't know if it's exactly that. And we know what you suffer from. And third, we look at you holistically. Most of the apps that you see, they treat you vertically. So it's an app for diabetics. It's an app for people who suffer from fibromyalgia or POTS disease. But I know as a physician that you never have one comorbidity. You are always unique. You are overweight, or you are young or old, and you have preferences, and you have a few comorbidities. So at Alike, we look at you in the same way that I look at patients in my clinic, holistically, with all the comorbidities adjusted to your age, to your gender, to your weight, preferences, and everything. And I think that's very unique. And we call it patient similarity network. So we actually make a network of similar patients, and that's very unique. That's exactly what's very difficult to look in the net, because try to look on the net at somebody in your age and gender that got a shot for COVID. It's difficult to find.
Yeah.
You hear it from many patients, but you don't know what's their background. So the credibility of the application and the way that we build it is very unique. And everything is anonymous. So it's real data, but it's anonymized. I think it's very unique.
That is the convenience factor, the accuracy, the privacy features, because like you said, some people don't feel comfortable sharing, all of their health challenges. And I love the holistic outlook, Dr. Varda. That's something you and I see eye to eye on, because a lot of these conditions are just manifestations of a deeper rooted cause.
Exactly.
And so when you look at the whole picture and you see all these different variables, then you can start to put the pieces together and understand this person is not just suffering from this one condition. It's actually at the root cause of their diabetes is the factors of their diet and their lifestyle, the fact that they are overweight and have this insulin resistance,
Yeah.
So you can kind of tie it back to a lot of other things going on to further make, changes for that person.
Exactly. And somebody comes and he complains about sleep disturbances.
Mm-hmm.
So you hear about the comorbidities, the age, his profession, his roles, what does he do, etc. And then you look at his labs. Sometimes you can find a reason, for these sleep disturbances. And it's not something that it's a complaint and that's it. So I think it's people who go like in your role or my role, they have to look at patients holistically. And by the way, medicine with the years became very professional and very niche of medicine. Okay, mm-hmm. So you don't have an ophthalmologist, but you have an ophthalmologist of the cornea. Or so you become so specialist that people feel that we don't see them holistically. So with patients like them, they can hear from many physicians that have seen these patients holistically, and they can learn a lot.
I love that. And I like the example you just brought up on the sleep challenges, because people listening into this may not have a chronic illness. Like you probably don't have, I know a lot of my audience and my community members are health enthusiasts. So similar to myself, they are looking to seek to avoid these conditions, and they don't presently have cancer or heart disease for the majority of them, for example. But a lot of us, virtually all of us, have some area of our health and wellness that we could improve upon. When, like you said, the sleep, some people may not be sleeping well. Other people, it might be fatigue. You just have you feel tired during the day and are relying on coffee too much. Other people might be brain fog. You feel like your mental focus isn't quite right. Other people, it might be digestive distress. You feel bloated or gassy after meals. All these different things that aren't usually classified as a chronic condition, but would still be very appropriate for these individuals who are overall very healthy, but have some aspects they want to improve upon. Your app, Alike.Health, would still be very appropriate for these individuals.
I totally agree. My first clinic started with very young patients. And I thought to myself, what would I do there? Everybody is healthy. Mm-hmm. But I learned with the time that nobody feels totally healthy. Everybody has something that disturbs him. And if it disturbs you, I call it's like a disease. The range between a symptom and a disease, it's a decision. If you have chronic headache, is it a symptom or a disease? Mm-hmm. If you have chronic fatigue, is it a symptom or a disease? So it's something that it's between the lines. And I think that everybody has his weak area that he can improve and he wants to deal with because he feels bad about it, and it doesn't help him to tell him that somebody else has a chronic illness and it's worse than what he has, So.
Sure. Yeah. Well, I want to give people an idea of what the process is if they sign up for Alike.Health, because this is a totally free app. Is that correct, Dr. Varda?
Right.
So it doesn't cost you a penny. It's accessible on Android and Apple devices. So virtually anyone could get it that has a cell phone. And so if someone goes to the website Alike.Health, very simple URL,
Right.
they could then sign up. What does that process look like? You
He
mentioned
downloads
entering.
the app, Alike.Health.
Okay.
And then he can add a provider, select his provider and add the data. In one click, a few seconds, all the data is downloaded. Everything is anonymized. So we throw every identifier of you when we download the data, and then we have the data and we don't have any identifier of you. We don't have your email, we have nothing. We can connect to you only through the application. And if you couldn't connect your provider, you can add your conditions and labs and procedures only by selecting them from a menu. We have like almost 2,000 conditions, and we are growing because we see that people want to be very precise. So it's not enough to say that you have hypertension. You want to say, is it secondary hypertension or primary hypertension? It's not enough to say diabetes, which kind of diabetes. And we actually go up with the granularity every time to give you more and more precise information about procedures and conditions that you can select the identical one that you want. And I see that people want to be very granular. They want to see somebody who is really, really like them, not on the same group of people. So since we are growing with patients, we are actually also growing the number of conditions as well. And with the time, we have more and more, and will be more and more special. The specialty will be even deeper and deeper with the time. So you add your conditions, and then you can post and ask patients and look at the feed. We have feed, and we have also chats with patients, and we can see patients like you. So actually you can look at how patients like you are treated. So if you have diabetes and hypertension and you are 40 and obese, you can see how patients like you are treated medically, and you can see options for other treatments, other medicines, and you can talk to patients about side effects, about effects, recommendations of complementary medicine, which is very important, and outcomes, about the journey that you have. And it's very fruitful to be there. And it's also fun. It's not, even though we are talking about diseases, it's life of people. So you see that people feel the joy of communicating.
Yeah, connection. That's the same reason people are drawn to any social media platform like Facebook or Instagram or Twitter, is that connection with other humans. And this is just a very specialized form of that's confidential, that connects you with the exact people you want to be connected with, that are going through the same journey. So I just absolutely love everything about this app, Dr. Varda, and I plan to begin using it myself. Because like you said, while I don't have any chronic conditions, there's always areas that I can improve, areas I can connect and educate. And I see myself being more of an educational aspect, where other people that are going through certain issues, I can maybe steer them in the right direction, give them tips I've seen work in my practice with people I work with. Do you have an option on Alike.Health for practitioners like myself who would want to go on there as a way to educate patients on certain conditions, or is it all patient to patient at this time?
So at this time, it's patient to patients.
Okay.
But with the time, we'll allow people like you, which are very important in the system, because, you know, we treat patients in our clinic one by one, and sometimes you can influence many patients and give them a lot of insights. So we'll allow it, but at the moment, we want to stress the benefit of talking with patients.
Yeah.
And, you know, I had an operation on my foot. And since then, I can give a lot of insights to my patients just because I went through this journey, you know. So, and I couldn't do it before. So I've learned so much just by understanding it, and, you know.
Yeah, that's a big difference, because practitioners and providers like yourself, you can read about it in a textbook, you can see other patients in your clinic going through it, but it's not the same as you actually personally going through it and feeling the fear of going into surgery and feeling the postoperative. Yeah, all these
Exactly. The post-op, the first night after operation, what do you do?
Yeah.
Which can you have? What should you prepare before the operation? What can you do for your chronic condition that will help you? And also, as you said, the loneliness and not being alone, and understanding that you are not alone in this journey, and it helps a lot.
Yeah, and those small details seem, you know, like not a big deal to a lot of surgeons because they don't have the time to go through this. But I can speak firsthand on this. I had a pretty major knee surgery after a very bad injury on a dirt bike accident years ago. And after the surgery, I didn't get any information on what foods I should eat, how it's going to impact my recovery, what things I should focus on. Are there any enzymes or vitamins or minerals or supplements I should be taking? Are there any other strategies like red light therapy or other recovery metrics I could use? Nothing was disclosed of that nature. All the surgeon told me was, here's some pain medication. If it looks infected, come back in, let us know.
Exactly.
And that was it. It was a 2-minute conversation. And so by having those insights of what I went through, I could tell someone else, like, hey, here was the pain level after the surgery. Here's what I did. Here's what I found to help. Here's what made me feel better versus worse. All those types of insights are so valuable and so important to be shared amongst patients to feel really empowered and have that knowledge and awareness going into something gives you so much more peace of mind.
I totally agree. And that's why within so many years of treating patients, I feel this gap that, and you know, patients today, they have to know a lot. They manage their health. Even myself as a family physician, that I have to manage their health holistically. I don't have enough time. I don't see all the details. And they have so many questions along the way, and they don't have the physician in their pocket, you know, all the time. So here they can ask everybody all the time. And you know, there is another thing. It's not only that you need help, you want to help others. If you went through something that is very disturbing and you found a good solution, I saw that patients really want to help others because they said, you know, I suffered so much. I want to help you. I want you not to suffer.
Well,
So it's the two ways.
Yeah, that's what life is all about at the end of the day. And that's what I've found on my journey is helping others is just brings so much fulfillment to your own life. So it's a two-way street. It's a person receiving the help, but the person giving the help gets as much benefit, if not more, from feeling the overall fulfillment and satisfaction and pride that you were able to impact someone else in a positive way. That's just so invaluable in the way that our human mind works and the way that really brings so much fullness to our lives. So this has been an amazing conversation, Dr. Varda. In closing, I want to just encourage all of my listeners to check out the app. You can go to Alike.Health, and that is just spelled the letter A, like, so ALIKE .health. And I'll be sure to put that link in the show notes along with the social media, like Instagram handle is Alike.Health. I know you guys are on Facebook as well with the same name. So I'll put all the links, relevant links in the show notes for all of my listeners to check out the app. It's completely free. You got a lot to gain, nothing to lose. And you might see me on there. I might be on some of these forums myself. So anything in closing, Dr. Varda, you want to share with my listeners?
So just to stress one other thing, that you can always see how alike is a person that is talking to you. So you have this number. He is 70% like me. He's 90% like me.
Very
So
cool.
look at the numbers and look at patients that are similar to you. Talk to them. You have a lot to achieve. And it was great meeting you. I enjoyed. And good luck to all our patients.
Thank you so much for tuning into today's episode. If you found it helpful, please share it along to anyone else you believe it can serve. You can submit your own question to be answered on the show by going to ryankennedyhealth.com/podcast. Be sure to subscribe and leave a review for the show. Your feedback helps to support me on my mission to positively impact as many people as possible with this information. Please note, the information depicted in this episode is purely for informational purposes only. Please consult your healthcare professional before making any changes to your lifestyle or routine.